today I just want to kind of briefly give you an overview of what ASERT is, and some of you may know what ASERT is, and some of you may not, and some of you may have used some of the ASERT related resources or developed resources and may not even realize that that's where they came from. So I thought we could kind of just give a real brief sort of overview of who we are as ASERT and how we function, kind of what we do, and then get into a little bit of a couple of the things that we really do statewide. I wanted to get into great detail about some other specific projects, but certainly a couple of the initiatives that may be useful to all of you, and certainly useful to anyone that you're supporting that may be autistic or certainly have an intellectual or developmental disability as well. So this is kind of who we are when we look at the state of Pennsylvania. So I think the first thing I had to clarify is what ASERT actually stands for. And ASERT is Autism Services, Education, Resources, and Training. And it's an initiative that's funded by the Pennsylvania Department of Human Services in the Office of Developmental Programs, which is the office within the state that provides a lot of the guidance, resources, and support, as well as sort of oversight of services for folks with intellectual and developmental disabilities, certainly autism, throughout the entire Commonwealth. And the way we are sort of set up is as a somewhat of an arm of the Office of Developmental Programs, but certainly the Bureau of Autism and Special Populations, which is another sort of subdivision within the Office of the ODP. And this is kind of how we've sort of broken up the Commonwealth in terms of regionally looking at resources, supports, services, and sort of initiatives across. So here in the West, we are the lead agency, UPMC, Western Psychiatric Hospital, Center for Autism and Developmental Disorders. There are 23 counties that we're sort of responsible for in terms of the region. Our director here is Dr. Marty Lubetsky, and Dr. Lubetsky and I work closely in sort of overseeing all of the initiatives within the western part of the state under this ASERT grant. We also have sort of across the Commonwealth other collaborators, and certainly in the central region is Penn State Hershey Medical Center. And then in the eastern region is the A.J. Drexel Autism Institute out of Drexel University. So we kind of collaborate with those entities across the state, and certainly we also collaborate within the region. So we have a number of different colleagues and collaborators, from providers to family groups to self-advocacy groups, and other professionals that have an interest in supporting and a stake in supporting those folks with intellectual and developmental disabilities, and again, certainly autism as well. So we kind of cut across there, and again, anything that we do in ASERT really is a collaborative. So nothing that starts here in the West, for example, will remain in the West. So any initiative, any project or program that we start here, we're required to sort of ensure that we're able to kind of ramp it up and make sure that it's available throughout the Commonwealth. And we're going to talk a little bit about some of those initiatives. So what do? We kind of look at what we call the kind of our different buckets that sort of all of our initiatives sort of fall into. And certainly education is a big part of that. So we do provide a number of different kinds of trainings. And it's all free of charge to a variety of different kinds of groups, whether it be professional groups, community-related groups, certainly even families, and definitely individuals themselves who are on the spectrum. We're able to kind of provide a lot of training opportunities, not only face-to-face, but certainly now, obviously, virtually also. And I'll talk a little bit about some of our virtual training opportunities that are available through our learning management system in a little bit. One of the other things that we do is support and connect. So really we do that through a number of different ways, and one of those ways is through our Resource Center, which is another initiative that I'll talk about a little bit later. And of course, building resources and programs, and also sort of innovative projects. And again, we won't get into a lot of that today, but you can certainly hear more about that, and I'll tell you where as we kind of wrap up today. And then just to kind of give you a sort of, well, where do we start when we think about, you know, training and building resources and projects? Really, we look at data, and I'll give you a couple of places that we look at from the beginning of ASERT, and then also as we've moved through ASERT, how we kind of look at the data and the needs of folks across time, and how we use our collaborative model to sort of help meet those needs in what might seem to be a basic way, but we think is a helpful way. The only thing I want to say here is, in terms of our role and purpose, is to just be clear that, you know, we don't see ourselves, and we certainly were never designed as a sort of be-all, end-all of autism support in the state of Pennsylvania. That was never our charge, and that was never sort of our goal, was to sort of just become this one-stop, only level of expertise that's available here. We know and we realize, and most of you probably know this too, that there's a variety of experience and good work that's being done all across the state. And we have some really good, innovative kinds of things, and really pretty good natural support too that exists all over in every county. Really, and our goal was never to kind of replace what's happening, or again, kind of take on that role of we're the be-all, end-all. We really are just kind of there to support what kind of exists, and also call attention to what kind of exists. And then if something sort of needs to be highlighted, or maybe even sort of tweaked a bit or adapted a bit, we can be available to kind of support that as well. So we're really just kind of our role really is to be this sort of bringing together of and conduit for resources and information, and also even services, to kind of understand, you know, what are some of the innovative things being done across the state. So again, not to replace, but certainly to support all of the good work that's already going on and continues to go on throughout the state. So this is the ASERT website is something that, you know, we're pretty proud of, and we've put a lot of time and effort and work into when we first began kind of our work. So I just want to briefly kind of make sure that everyone on the call today is kind of aware of our website. The address is there on the slide, paautism.org. And just to kind of share a couple of the features there, one of them is you can find out in the section that's labeled there, you can see it here at the top, Autism in PA. And that section includes a number of different kinds of sources of information, but it also includes the information that we really based a lot of our sort of initial projects and efforts and initiatives on. And that's the PA Autism Census, as well as the PA Autism Needs Assessment. So really, we drew a lot of that basically from people telling us this is what's needed. So we drew a lot of initial efforts in terms of resource development, training, and other kind of projects and programs. And that even kind of dictated sort of who we were looking to collaborate with, and how we went about looking for expertise. So those two sort of initiatives, the census as well as the needs assessment, were pretty big, heavy lifts initially in ASERT's existence. And it was really one of the first things that we did across the state. And again, that was really where we drew a lot of the data that kind of directed where we started with a lot of our initiatives. So you can find that information there on our website, paautism.org. The other couple of things that just to be aware of on this website is that it is searchable. So any resource that we develop, and we'll talk about some of those here in a little bit. But any resource that we develop will land here in sort of this warehouse, and that's kind of how we refer to it, sort of resource warehouse. So it lands here on paautism.org, but you also find resources that already exist in other areas that are useful. So, you know, one of our goals is never again to replace or even obviously reinvent the wheel. If something is good, we just want to be able to kind of pull it over in a collaborative way with permission, pull it over into one place where it's more easily accessible and people can kind of get to it more quickly and easily. So not only are our resources that we've developed are located here, but definitely all of the other ones that we've sort of taken from other areas and again, with permission, with given credit, are kind of pulled into this warehouse of resources. And of course, it's a searchable website all across every different kinds of things. And you can see, you know, you can kind of select a category to view some of the resources on there. The other thing, feature I should mention is the idea of sort of our creating a profile on the website. And what that allows you to do is to kind of curate resources that are particular to you. And also based on your role, we can also kind of drive some of those resources over to your profile, to your account. So just if you're going to make really good use of our website and the resources that are there, creating an account is probably one of the first steps that you'd want to take. So again, just calling your attention to a couple of those things. And that, again, this becomes a real place for us to not only kind of warehouse the resources, but it also gives us a nice place to send folks to get those resources. And again, a little more easily accessible and a little more collected and bundled together to be able to kind of access easily. So the ASERT website really is a part of the Resource Center, the ASERT Resource Center. But I wanted to talk a little bit about this initiative because this is something that we learned early on, and this is one of the, probably one of the first initiatives that we had kind of rolled out statewide, was this idea of having a number for folks to call. No matter where you're living, no matter what you're calling about, no matter what the need might be, but you could give a call and someone could try and provide you with some information or at least some connection or resource that might be useful given whatever question or concern that you might have. So when we talk about the Resource Center, it really is a place for someone to go to. And again, it doesn't matter the age of the person, it doesn't matter whether it's a professional or a family member or certainly even an individual on the spectrum. And we've received plenty of calls from folks themselves just with questions about different ways of doing things, processes, and information and resources. So it really is sort of again, it's one number that somebody can call. Again, we're not here to replace anything because there are lots of numbers out there and lots of sort of resources that folks can tap into locally and should continue to do that. But this is, sometimes this is a good start, and what we found is sometimes it's a good starting point for folks. So just to mention this though, because again, I think sometimes it's misunderstood what our ASERT sort of resource center does, and it is not a crisis line. So it's not something that where someone can jump on and get support at a moment's notice, and definitely not an emergency or a crisis. So just kind of making that clear. We learned early on that our processes are just not set up to do that. And we certainly aren't counseling either. So that's another area that sometimes we get confused that, folks can kind of give us a call and we can kind of sit and either through telehealth or phone provide some level of counseling in that way. Although, we've had folks call us and not really know why they're calling or really what they need. And we've certainly provided some direction or some support to kind of figure out, well, what's a good place to start or what's a good resource that might be effective for them. And again, not necessarily counseling or therapy, but certainly helping provide some guidance. So this slide really just talks about some areas that we do actually want people to call, and some others that it's okay to call. We're not telling you not to, but we're probably not set up to do that. Obviously, to learn about supports and services that are available in Pennsylvania, we absolutely would want someone to call, and we can provide that information. Sometimes we do get calls, though, from folks who want to enroll in sort of direct supports and services, and they want direct supports and services. And that's not something we do. Although, again, we can make that connection. We can give you the information about where to find that and how to get it. But we're not providing that service, and we certainly don't control anything that any means of kind of enrolling in services or being evaluated for services or anything along those lines. Things like we do provide sort of resources on emergency preparedness and mental health and those sorts of things, and also sort of crisis related information like how do I get a hold of my local crisis line, that sort of thing. We can certainly provide that, but again, we're not an emergent sort of crisis line ourselves. Certainly if someone's living in Pennsylvania or moving to Pennsylvania and has questions about supports and services, we certainly encourage folks to call. So we get plenty of calls from out of state who are looking at moving to the state and kind of looking for what might be available, and we can certainly provide that information. But if it's someone outside of Pennsylvania and they're looking for supports and services and resources in their area, that might be a little bit more challenging. Although we do take a lot of calls from out of state who are just looking for anything at all. So we can sometimes help kind of direct within their own state and within their own local areas. But most of what we do really does focus on Pennsylvania. Tips and resources on choosing the right provider, how to do that, how to look for it. But we're not allowed to kind of provide specific recommendations for providers or services or programs or organizations. We're not going to do that. We just can't do that. Because we are funded by the state, it can show some preferential treatment if we start, saying, please go to this program specifically for this service. So we're not able to do that. We can do things like find some information about where to find grants and other funding, but we're not able to provide any funding to anyone. We're also, if someone wants to promote autism-related events in Pennsylvania, that are free or low cost, we actually have an events page on our website where anyone can access that, and it does kind of go through a calendar and gives some information about what kinds of events might be available. But we try and not promote fundraisers or high cost or out of state events. We're also not set up to provide any kind of financial or legal advice, but we can also kind of guide folks to what resources might be available to them locally. And then, of course, obviously, we would want folks to call if there's any kind of needed training. We can provide that, again, virtually, and in some cases, face-to-face as well. So once someone calls our resource center, depending on where they're calling from, it's sort of we have sort of a triage in a sense, where folks are, then the calls are, we create tickets based on the call, and those tickets then are sent to these specific regions. And you can see here kind of how we break down the calls. Most often it's by region, where the person's calling from. We try and collect information about, where the person's calling from, so we're better able to have that person directed to somebody in that specific region. There are some other specific things that might come up. Here in the Western region, we do take not only the calls in the Western region, but certainly anytime someone does not provide county or location, we also kind of make that call. We also take a lot of the calls related to looking at interest lists for things like waivers and how to get on interest lists and how to register for services and those processes. So we take a lot of those calls as well here in the West. But this is something that's available, again, this is a statewide effort. So it's one number where someone can call no matter what county they're in or region. This is sort of how we function. So we have an English and Spanish, what we refer to as warm line. It's not a hotline, it's not a crisis line, but certainly it's a warm line where someone will, it's a process whereby someone leaves a message, and then we create those tickets and triage it to the appropriate region. And then someone from that region calls back or gets back in touch with the person. Certainly we're all over social media as well, and you'll see some of that contact information later on. And then of course we also function through email too. So that becomes part of how we can kind of connect with folks who have questions through our resource center. I want to mention our e-learning platform too, because I mentioned that we're set up to do trainings in a variety of different ways. And one of those ways is through our Lantern system, our Lantern learning management system. And there are a number of different already kind of created training opportunities and courses that are on our Lantern. And this can be, again, accessed through paautism.org. There are different kinds of courses for self-advocates, direct support professionals, certainly clinicians, and any caregivers or even community members as well. The opportunities that are available in Lantern are not only sort of, talking head trainings, although there are some of those. We do have some videos and interactive content on there. And there's also access to some of the print resources that we have created over the time that sort of, we've kind of collated then into a learning experience that includes other things like videos and other content. Other topics, things like mental health overviews, strategies, neurodiversity, resilience, clinical competencies, there's a number of those kinds of things. Some of the key things that are on there right now, this is where we conduct one of the initiatives, or one of our training initiatives called TRAIN, which is looking at adapting trauma therapy for individuals who are either on the spectrum or have an intellectual or other developmental disability. So it is a cohort kind of training, but all of the materials and all of that process exists on our LMS, the Lantern LMS. Project Reassure is something that's recently been now available on Lantern, and it's done for direct support professionals and as well as self-advocates, which exist now up on there. And it is sort of, again, there's some print and video and other content related to this topic, and it really is just sort of about resiliency and trauma. So a lot of that is, it's all self-paced, it's all just information that's downloadable, and you can kind of watch when you can. We also have lots of resources in terms of learning management system with an initiative that we call Be Well, Think Well, which is really around behavioral health, and also just sort of diagnoses, different psychiatric diagnoses and information related to that. Some of it's geared towards caregivers and professionals, but some of the information within that Be Well, Think Well initiative is geared specifically towards individuals on the spectrum themselves. Just to kind of highlight some of the resources that you can kind of access on our website, and this is certainly not, I'm not going to be able to present everything to you today, certainly, but a number of these things are sort of our biggest hits, meaning our greatest hits, right? Which are just things that we know get accessed quite a bit, because again, we can kind of collect data. And I just again, a lot of what we do, again, as I mentioned before, was based in, sort of data that we've collected. So when we develop sort of a resource bundle or resource spotlight or resource, just maybe it's a one-pager on a topic, we do that based on what we're getting called about. So what information people are asking us for, and oftentimes something doesn't exist, or we have sort of our standard way of responding to a question about a certain topic. And based on that, and again, the data that we collect through our resource center, based on all of that information, we begin to kind of create our own resources that would then be able to be accessed on the website, but also again through our resource center where someone calls, we have an easy kind of resource to provide that, again, it's adapted, it's accommodated, and anyone, it's accessible entirely, and that becomes really useful. It's easy to read, easy to access. One of those areas is the Medicaid waiver. So this bundle provides some overviews of what the waivers are, what services are provided or offered under the waivers, and also information about registering for these services in Pennsylvania. So there's information on eligibility, what that looks like, and how to apply for services through the county. There's a checklist that a person or a family member can kind of utilize to kind of make sure they have sort of all their ducks in a row and the documentation necessary to go to the county to register for services. Again, that's a bundle. All of those things are bundled together in that particular page, which is something we've been focusing on, taking a lot of our resources that really sort of connect to one another and bring them all together in one page, one place for someone to utilize. We have what we call support professional resources, and it was an initiative that we underwent a few years ago, and again, just focusing on people who are delivering direct services. So, anything from just basic information on autism to how to support someone with relationships, how to support someone with goal setting, and even safety, and navigating services. These are all topics that are kind of within this resource bundle, and you can see the link there. And I think, Rachel, you can certainly send out some of this PowerPoint, so anyone in attendance can have access to any of these links and that information. And this is just sort of a look at what this looks like. So it's a kind of a combination of things. There's some print resources that you kind of download and have, but there's also sort of some tips and hints. There are some videos included in this resource also. One of our big training initiatives is around the justice system and providing training and information and resources to those professionals that are in the justice system. So anyone from police to attorneys to district attorneys to judges, magistrates, all across that spectrum of folks that are working in the justice system, parole officers, and certainly even correction officers as well. But we have a justice resource collection where all of our resources, there's some really good, nice resources specifically for justice professionals, but there's also some nice resources for autistic individuals in order to understand the justice system a little bit better. So a lot of that exists on our website under the justice resource collection. There's information about different social stories, but also sort of our training project as well. So we've done a lot of interaction with the Pennsylvania Supreme Court justices as of late. We've also done magistrate training in autism across the state, across the Commonwealth. And we have a lot of different collaborations that we utilize throughout the state in order to reach those folks. Also, this is kind of an example of, this is not something we created, although it's something we kind of pulled together. There are many really good transition toolkits available. So what we've done is taken those transition toolkits, which is just sort of kind of give advice and resources and informations that people can access to kind of move from one transition in life to the next. So we've taken those toolkits and kind of combined them to get together into this one resource that really we've taken those toolkits and labeled them and categorized them based on age. And so you can kind of look through that, and it's resources that kind of go throughout this lifespan that kind of help prepare for that next age range, so to speak. So again, not a lot of it is what we've created, although there are some things that we've created in there. This is really kind of pulling together really good resources that already exist into one place so people can access them a little more easily. This is resources on Act 62, which is the autism insurance mandate in Pennsylvania. So this is something that does come up periodically in discussions. Certainly, families have lots of questions about insurance and what services might be paid for. So there are a lot of resources on our website on the Act 62, the autism insurance mandate, things like what is it? And there's some general information for families. And again, it's kind of done in a more a clearer way, a more understandable way, a more user-friendly way. What are the differences between private insurance and Medicaid? Because that Act 62 really is, the law itself is really sort of related to private insurances being able to pay and being mandated to pay for autism-related services, which is, this has been around for quite some time, but there are still things that, providers and insurance companies and certainly even Medicaid is learning as we go. But these resources are really kind of more for families and individuals to kind of understand what Act 62 is and how it might be helpful or useful. We do have an election coming up, certainly. And one of the things that we found is that obviously individuals on the spectrum, autistic individuals, have a very high stake when it comes to policy and also even just voting and having their voice heard. And we know some very active self-advocates who are wanting more, who needed more information and perhaps even just some guidance about the process, what this looks like, polling places, how to apply, how to prepare to vote, that plan that we always talk about for planning to vote. So this is a sort of a voting resource page that we've developed with a number of different kinds of resources to help people kind of figure out that process, be aware of it, what to do, how to find information, that sort of thing. So there's a lot of useful information there to advocate for oneself. This is actually, again, this probably was one of the first pages that we really worked hard on, was to kind of show across the state where those support groups exist. So we have a map on our website that's totally interactive. It's clickable, meaning you can find the county, click on the county, and it'll pop up with what support groups are on there. Of course, online groups and certainly even in-person groups are included there. This is a pretty significant go-to resource for a lot of visitors to our website, where they're looking for that sort of a lot of information. And again, the self-advocacy groups, the family advocacy groups, the sibling support groups, these are significant, not only for support and guidance, but they're also just a wealth of information about local resources. And one of the things that we often do is, as ASERT, when we get asked questions again about specific providers, and again, that's not something we're able to provide, but we know that there are several local support groups who oftentimes even kind of keep their own lists, and oftentimes their lists of providers are based on their own experiences, and they certainly can share those. So we oftentimes encourage folks to take a look at that support group map and not only utilize the support that those groups certainly provide, but oftentimes they can provide that advice that we're just not able to, that professionals just aren't able to, because again, oftentimes it's based on their own firsthand experience. So the support group map is a pretty user-friendly opportunity to kind of find those groups. We've more recently kind of looked at the support group map and categorized it a little differently between what we think of as traditional support groups and then also kind of social related groups. So you can kind of go on there now, and when you click on our support group map, it kind of gives you those categories that you can kind of click into, and it kind of differentiates between the two kinds of groups that are there. I don't think I mentioned this, but it's the Be Safe resources. So we know that folks certainly with intellectual and developmental disabilities, there is a much greater risk for victimization. And this has been a case for a while. So this is an initiative that we've undertook a few years ago called Be Safe. And really it's just a bundle of resources on prevention of victimization and intervention. Some of the resources are there for caregivers, supporters, but there are a lot of resources on there specifically for individuals themselves to be able to access in order to kind of be safe around being victims of abuse and other things too. So just an opportunity to kind of take a look at those. And this is, again, based on, again, data and questions and information, not only through our resource center, but certainly from our state collaborators as well. We also, as I mentioned before, we have another initiative that we call Be Well, Think Well, and again, a bundle of resources around mental health, behavioral health. There are mental health resources, special topics. There are some social stories around things like anxiety, depression, those sorts of things. So all of that's included there as well. We also, on the other side of that, we do have a physical health resource bundle, because we certainly know autistic folks oftentimes struggle with physical health or medical issues, and there are some good resources. Again, not everything that we've developed, but some good resources that exist but are on. We've kind of collated and collected into one place. Again, making it a little more accessible and easy to use. That are kind of right there in that bundle of physical health resources. Some other things like our early childhood resource bundle, developmental milestones, early signs, newly diagnosed information, all there for early childhood. And then on the other side, the next step sort of is our early intervention resource collection, what talks about early intervention services in Pennsylvania and accessing those services. How do you go about doing that, and what does that look like? We do have an LGBTQI resource page with background information. There's resources for individuals, but also for parents and families, and also even information for policymakers and providers too. So that exists all in one place, resource page bundled together, lots of good resources. Some of them are really just links to other organizations that can be supportive and helpful, not just things that we've developed. Just to show you, again, one of the big things that we were getting a lot of requests for was sort of resources around the library and training library staff, and what are some, how do we make sure that we're accessible in terms of library, how make sure that we're accessible. So there are some information there, preparing someone to going to the library, some social stories. There's also resources for the library staff themselves, including librarians. We do have a whole bundle of resources for visual schedules, visual resources, which is, again, this is something we get a lot of questions about is, what are some of those sort of tips or hints? So around visual schedule, there's a number of different things, how to create a visual schedule, different kinds of resources related to using visuals as a way to help someone sort of organize and plan, but also for teachers too, to help utilize teaching new things, new experiences to students. This has become a really highly utilized resource on our website, and that's the Social Story Resource Collection. We have information there about how to make your own social stories. We have a number of examples of social stories that live there. There's also social stories for kids, for adults. Lots of good things there. Lots of useful sort of visual information there. This is just this was an effort, another collaborative effort between ASAN, which is an advocacy organization, and ASERT. And the Self-Advocate's Guide to Medicaid was developed, so it helps folks understand, again, in a little more accommodated way, what Medicaid is, what it does for that person, how it's helpful, how to go about getting it and obtaining it. So it was a very good collaboration. And I always make mention when we talk about this guide in particular that all of the things that we've talked about today, all of these resource bundles, and certainly the ones that we haven't touched on, have not only input from professionals, obviously, who are supporters of autistic individuals, but the developers of all of these resources are also, it's a collaborative effort with the autistic community as well, whether it be families or autistic people themselves, who are collaborators in the development of these resources. So it's not something that we sort of just say, this is what we think people need. We have the input. We also, we oftentimes employ, well, we do. We're employing folks in ASERT for that primary reason, to give us that firsthand experience, and to review and to create resources that make sense for the autistic community. Fire safety resource page is also just kind of an example of something that we do have there. Fire and rescue, safety signals and tips, social stories about fire safety all exist within this bundle. I want to mention just a couple of other really briefly, a couple other little initiatives that we have. One of them is ASD Next. It's hashtag ASD Next. But it's a website, resource and connection that's providing resources and connection for autistic individuals transitioning to adulthood. So this is primarily a resource for young adults and adults that are kind of moving from school to work, or school to college, or school to other things. So growing up, right, transitioning, and it really, the goal was really just how can we help make transition a little easier by sort of connecting individuals to others who have a shared experience, community, and then providing some level of community resources and information as well as support. So we, a little bit about ASD Next. It's connection for teens, young adults, families, and communities. So it kind of goes all over the population. We have a lot of resources specific to transition, specific to employment, specific to college. All of those resources exist on the ASD Next. Also have a social calendar, which is more of an events. So we talked about the events page on paautism.org, but on ASD Next, it's more of a social calendar. We do have blogs as well that are written by autistic folks, providing a variety of different points of view that exist there. There's opportunities there too for social media interaction, not only with us as ASERT, but certainly with each other, with users of the site. So, just some highlights here. We have some resources on dating there, transition, and certainly even on coronavirus and how, how folks on the spectrum can kind of continue to, certainly in the past, but even now, continue to kind of look for information that's valuable, but also, we know it is evidence-based as well. The blogs, we have 18 bloggers from across the Commonwealth, including right here in Pittsburgh. And those blogs are a variety of experiences and topics. And sometimes there'll be a theme that maybe 9 of those 18 bloggers will kind of write about their own experience based on that theme. And there is a community page. This is something that's recently we've kind of rounded out and really kind of emphasized, and we added some added value to it. So there's a place for people to interact with one another on this community page. Certainly it's monitored, but if there's an opportunity for Discord chats, there's some interest surveys, get information on events, and again, some of the blogs are there specific to some of the themes, but there are also kind of other ways to interactive games and things like that on the community page. But this is a nice opportunity for autistic folks to be able to kind of talk about their experiences with someone who may have lived the same kinds of things before. So it's a nice connection tool for folks. I want to mention just again really quickly an initiative that started back in 2020, in the pandemic, and the reason we started AID in PA was because of the pandemic. But it's a website that we've dedicated. Again, we started it as a sort of a place to go during the pandemic that really looked to support individuals not only with autism and on the spectrum, but certainly individuals with intellectual and or developmental disabilities of any kind. It was really a way to kind of give information to not only folks themselves, but certainly parents and caregivers and professionals all across the state. This was a collaborative effort. Again, very rarely are you going to see just an ASERT thing come out. But we worked along with the Philly Autism Project, along with the Pennsylvania, again, Office of Developmental Programs, and also our sort of colleagues at the Healthcare Quality Units, or HICUs, which are organizations that are situated across the state, and they're really focused on the health care of individuals who are receiving services within the Pennsylvania provider service system. So oftentimes this means the Medicaid waivers system that ODP sort of oversees. So the HICUs really focus on those folks that are, receiving services like vocational services under the waiver, or residential services under the waiver, those sorts of situations. So we collaborated along with them to start this AID and PA. Again, really the focus was around the COVID-19 pandemic. That's where we wanted to make a good, reliable source of information for folks during the pandemic. ASERT and the HICUs, we were the initial content creators for that. We know that ODP said there are some urgent needs. Obviously, in COVID-19, this was sort of our assistance that we were able to offer. We had all kinds of things on there, and it's still on there about COVID-19 and the pandemic. But there's some webinars, some prints, some just valid, good information from external sources also exists there. Again, really focused on the pandemic. We've sort of evolved, though, not to go away from an emergency focus or an emergency response focus, because there are certainly lots of emergency response related resources on there, to not only to include the COVID-19, but certainly weather-related disasters, other emergency-related situations. An example is we've just finished up and added to AID and PA a social story on evacuating your home during a disaster. So that's just an example of some of the resources. Some other things that are on there, this is where this is where Train and a lot of the information on Train, that process exists there. We mentioned before Project Reassure, a lot of those. So we're really just kind of looking to address under AID and PA, not only the crisis and emergency piece, but addressing a wider range of challenges, including things like trauma and support for trauma. And that's where a lot of these resources live. There are just another example of what's there. A year or so ago, we worked with folks in Department of Human Services around and the Department of Health around human trafficking, and develop some resources around human trafficking. So those exist on AID and PA as well. So that kind of sums up some of the things I wanted to make sure that we touched on today about ASERT. I did want to make mention that this Friday, so I'll be presenting, and then Dr. Greg Chirpus, who is the medical director for the Office of Developmental Programs, will also be presenting at this conference, sponsored through Education Consultative Services at Western Psych. Dr. Kim Mathis is the course director. But disability awareness, innovations in defragmenting mental and physical health care for people with disabilities. We're going to talk about ASERT and just kind of the way our collaboration and how we use some of our needs assessment and other data to create one of our clinical training programs for psychiatric rehabilitation. We're going to talk about that, and then also some other capacity building initiatives. Dr. Greg Chirpes will be talking about that, who is, again, we work closely with him because he is, again, medical director of ODP, which is, a big collaborator and certainly our funder as well. So you'll hear, if you're coming to this conference, it's a virtual conference, so you'll hear a little more detailed about ASERT. And also, just lastly, just letting everyone know, the Pennsylvania Autism Training Conference, which again ASERT helps kind of bring together and plan, and we're also presenting about some of our more specific initiatives and projects across the state during the we call it PATSI, so it's November 5th through 7th. There's a registration link there, and again, you'll be getting this. All of our connections on social media are available in this slide presentation. And then, of course, our website, as well as our contact for our resource center, is there. Our email, info@paautism.org.